Welcome everyone to today's webinar, Unblock Organizational Performance, Switch from Transactional to Transformative Learning. I am Brian Zimmerman, Senior Director, Client Content and Strategy with Becker's Hospital Review. We'll begin today's webinar with a presentation, and we'll have time at the end for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our terrific presenters. We are thrilled to be joined by Reagan Sanders, Senior Success Manager, Compliance Solutions, and Debbie Blanchard, Success Manager, Compliance Solutions at HealthStream. Debbie, I'll turn the floor over to you to begin today's presentation.
Great, thank you, Brian. Hello, as Brian said, my name is Debbie Blanchard, and I'm a Compliance Success Manager with HealthStream. I've been with HealthStream since September of 2019 and have been working in the healthcare industry for the past 21 years. 14 of those years were working in the behavioral health space. I've been a Success Manager since 2010, and here at HealthStream, I'm on the quality and compliance team, assisting our customers with recommended practices and helping them to get the most out of their annual mandatory training. Today we're talking about transactional to transformative learning, a hot topic in today's environment. Over the last year, we have seen the transition to remote learning take wave across healthcare. We are going to start off today by giving everyone a little bit of background on what we are hearing from the front lines of learning and development and how it has changed over the years. Reagan will start off our presentation.
Thank you, Debbie. My name is Reagan Sanders, and I am a Compliance Success Manager with HealthStream. I joined HealthStream in 2011, and after implementing HealthStream at the hospice where I was working. During my tenure at hospice, I worked in the learning and development in partnership with our quality and risk management group. After joining HealthStream, I worked with customers to transition to ICD-10, and now I work with quality and compliance products to help organizations streamline annual mandatory training. I'm going to start with a little walk down memory lane. In 2004, my first job was in that hospice in learning and development. And during my time there, I saw an evolution of training, but it took us several years to make those changes. And when I started, we were relatively small. We only had about 200 employees. When I left, we'd grown to 1,400. As we grew, our learning and development model quickly started to fall apart. On my first week, I sat through daily 8-hour lectures, everything from the CEO stopping by to say hi, to hand hygiene, to clocking in, and the list just went on and on. Some applied to my job, and some did not. I remember only one thing from that first week, and it was a joke the CFO told. Our organization was using live training. It had take-home packets with tests that the employees had to return, and we had employee files full of past tests, binders full of sign-in sheets, and hundreds of versions of PowerPoint presentations. It was an endless sea of paper and stacks of binders. We all knew it was too much, and I remember asking my director at the time, why? Why was it being done this way? And her answer was pretty simple. Well, that's the way it's always been done. And I remember thinking, okay, well, that doesn't make it the right way to do it, but I'd only been there a few weeks and I had never worked in healthcare, so I didn't really question it. And then before COVID started, we were kind of seeing this slow industry shift away from live training and those long, repetitive PowerPoint-type e-learning courses towards this more streamlined approach to education. And in the months leading up to COVID, I was seeing that shift of the way organizations wanted to deliver training. And they had this new generation in the workforce that was pushing us. They're pushing us to be better, pushing us to change. And they started asking why. And that standard answer that we've been giving, that's the way it's always been done, wasn't a good enough answer anymore. And executives and leaders were starting to take notice of all of this time-consuming, repetitive education and pushing us for time savings and reduced training costs. And holding those week-long orientation classes were slowly being pushed out. Right before, in the summer of 2019, I spoke with a chief learning officer in a mid-sized hospital. And she called me and she was in this huge panic. Their CEO had sat through their orientation program, and she was this was the first time this has ever happened, and I didn't know he was going to do it. But he came into our office and he sat down and he said, my directive to you and my challenge is to cut orientation by 75% in 2020. CL said that's not possible. They need this information. It's imperative. And the task of reviewing all the content they presented live, assigned via e-learning, and provided in packets was daunting and overwhelming. But we sat down and we came up with a plan, and we started reviewing their live content, the e-learning they required, and all the paperwork they provided. And through that collaborative effort, we found approximately 50% of the content was mentioned in multiple presentations. The light bulb started to go on. They started to understand how to change and how to cut that content. And so in March, when COVID hit, they were agile enough to pivot again. The hour of live orientation they kept easily moved to online, and they quickly assessed their offerings to determine where they needed more training. Some organizations weren't lucky. They didn't have time to review everything. Today's organizations face this global pandemic, and it's put a new focus on learning and development, forcing our organizations to pivot and adapt in weeks to changing landscape of healthcare that before would have taken our industry years. It's making us question everything from how are we delivering care to how we train our employees. Having worked in the healthcare facility, I have nursing contacts and friends, and I even have family working in acute and non-acute settings. And I started to reach out to find out how I could support them, what were their immediate needs. But as I stayed connected to them throughout this past year, we started to talk more about learning and development needs. Those in the hospital settings were worried about those immediate staffing needs. And in the hospice, they were concerned about helping their staff understand COVID and having them go into those patient homes. And my friend, Mary, she's worked in about every setting in the hospital. And she's been in healthcare 25 years. She was in learning and development with me for a couple of years. And about 10 years ago, she moved into a nurse leader role. And she constantly worried about three things. Obviously, the shortage of PPE, but her staff being redeployed without the proper knowledge and training. And then last, she was worried that they would ask her to go back on the ICU floor. And she had physicians reaching out to her. How can I learn more? What if they redeploy me? How am I going to learn and get up to speed? And Mary realized very quickly that the cracks in learning and development were getting wider. And my cousin Sue, she's been an ICU nurse her entire career, and she was just getting ready to retire, but she stayed in her job. And as I spoke to her about, what her biggest challenges have been, she told me several things that she faced personally and professionally. And she said she was caring for the most critical patients of her career in larger volumes while mentoring nurses who had never been in the ICU before. And it was this huge struggle for her to adapt and to feel like she was making a difference, not only with the patients, but with the new nurses that were redeployed into her ICU. And I know that this is all things that we've heard before, but it's a good reminder. And of all of the industries facing this new COVID landscape, healthcare had the biggest challenges staring them in the face regarding learning and development. How do we educate people quickly? How do we adapt and pivot our learning and development programs? And looking back over the last year, we want to celebrate all of the wins. We want to take a microscopic look at everything we've learned. And adapting is key. I have a quote I occasionally look at just to remind me, if it doesn't challenge you, it doesn't change you. And out of all of the challenges over the past year, we really need to focus on how are we going to adapt learning, and how do we look at it, and how do we transform learning to be effective and efficient, yet engaging for our employees and our clinicians across the continuum of healthcare.
So by constantly reevaluating, adapting, and trying to keep your finger on the pulse of what is happening in learning, it gets us to thinking and asking the question, what are the challenges you face in learning and development for education in the healthcare industry? Well, let's take a few minutes here to identify what some of the challenges or obstacles are that we are seeing and hearing about. Some of the biggest challenges are adequate time, resources, and technology to develop engaging content. Also, there is a need for specialized training and a way to measure the effectiveness of that training. So turning educators' focus to content development means less time spent supporting and developing staff in group or individual settings. A greater challenge is the shift of focus away from long PowerPoints to micro-learning content. Educators are spending time learning how to cut content and focus on the necessary information instead of all the little details. I have found working with educators, it can be a bit of a challenge for some of them to let go of the details, like the history information, and get to what learners really need to know to do their job effectively. And at the same time, the trainings need to be consumable across different devices in remote settings. And we know a lot of us have had to deal with moving to and working from a remote setting during this past year. Another challenge is a vast majority of education needs to be specialized. We have a wide span of employee experience as well as age and cultural differences. So an employee starting out their career in healthcare today needs a different education path than, say, an employee who might be in the healthcare industry for the past 15 years. Also, the ability to measure where the training is affecting change in behavior or increasing competency continues to be another challenge. But the good news here is that more and more data is becoming available with tools like data analytics. So we are moving towards closing that gap. You know, a lot of it is all about how we adapt to the new learning environment we are in. Next, let's talk through how to start adapting to the environment we are in and what it means to have transformative learning at your organization. My new favorite term is unconscious incompetence. We are all guilty of this, so please don't be offended. It simply means you don't know, you don't know. Think about it. This is the basis of where we want to move healthcare learning. And with adaptive learning, it optimizes your training by eliminating our unconscious incompetence before it affects performance through a formal assessment process. The assessment process determines where the learner is. Take a look at the definition I have on screen here. Here at HealthStream, we are commingling the term transformative and adaptive to mean the same thing. Here it says, adaptive learning provides personalized learning. So it's all about the individual learner, which aims to provide efficient, effective, and customized learning paths that engage the learner. It uses a data-driven approach to adjust the pace and path of learning, enabling the delivery of a personalized learning experience. So adaptive learning is all about the individual learner and about the needs that exist right now to allow the learner to become proficient in the material that they need to learn.
This is Brian with Becker's. Just jumping in here, I believe we're having some trouble hearing audio here, so we're working on this on the back end. Debbie, Reagan, can either of you hear me?
I can. I apologize. I think it was me.
Okay, gotcha.
Thank you. Transactional learning is that one-size-fits-all approach. So it's most predominant in required annual education. Annual education is something everybody needs to do, so you can maintain regulatory standards. Therefore, annual education was designed with that one-size-fits-all approach in mind. So let's face it, annual training is not exciting and it rarely changes from year to year. It's time to take a more personalized approach to time-consuming, boring annual training and flip it to transformative learning. Develop personalized learning where employees within health systems would complete their annual education based on the knowledge they currently have or the knowledge they don't currently have. In transactional, it's all about taking the test and recording that test score. I take the test or I take the quiz and I get the grade. And that is how a lot of training is done in healthcare. Adaptive learning begins to shift that model. And now you're looking at an analysis of learner behavior to drive your outcomes. The 100% or 80%, that passing score, that's not what you're looking for anymore. You're looking for the lower score to help improve individuals, which in turn improves your outcomes. We all sat through the PowerPoint presentations or the self-authored courses, the education where it's slide after slide, and by slide 6 you're getting antsy. And as you continue on, you're getting a little distracted, and then you just start clicking through the content. We know it happens all the time. I know I'm guilty of it, especially when training that I think I know. I've seen the same content for the last 10 years. We all get complacent. So transformative learning goes beyond simply acquiring knowledge, and it dives into the way that learners find meaning in their lives and understanding. This kind of learning experience involves a fundamental change in our perceptions. Learners start to question all the things they knew or thought before and examine things from a new perspective in order to make room for new insights and information. Many learners and experts agree that this kind of learning leads to a true freedom of thought and understanding. So transformative or adaptive learning is going to eliminate that huge need for that slide set with tons of content and take that more micro-learning approach. Micro-learning has really caught wind in the last few years, and we see it now being more adopted in healthcare. Micro-learning is brief modules in bite-sized pieces. Typically, the time to complete micro-learning is 3 to 10 minutes, and it's delivered over a period of time to allow for those quick bites of consumption. Microlearning becomes more about the learner going out there and seeking what they need. Society's become very used to information at your fingertips. Think about your phone and your iPads, how quickly you can get information. Just go and you Google something. I can watch a YouTube video on anything from sewing a mask to replacing a car engine. So those micro-learning has a little bit of that same preface. You go through your mobile device, you quickly consume the educational information you need, and you go on with your day. It's not about spending hours upon hours sitting through 50-minute long PowerPoint presentations. Transactional is about the knowledge transfer. Think about physicians in med school. During med school, they're sitting there in a classroom. They're in a situation, they're learning from textbooks, and it's just that transfer of knowledge. Adaptive or transformative learning comes into place when you create more of an experiential learning approach. That hands-on approach to learning through experience, observation, and interaction, the actual doing part of the learning. It removes the classroom and allows it to become more hands-on. And we're seeing this as simulation labs start opening in healthcare organizations around the country. I'm reminded of my first look at a sim lab. I was touring a healthcare facility, and they were kind enough to take me through their sim lab. A group of nurses and doctors were in the room practicing birthing a baby. And there was a mannequin who was actually in labor. I was fascinated by this. The educator told me they could use a variety of programs to simulate all these different outcomes. And the team was taking the simulation very seriously. And I was so impressed. Later, I was reflecting back on that high-pressure environment and the distress the mannequin was in. And it was an opportunity for the team and the team members to make mistakes, to fail in this safe, controlled environment and learn from each other. Simulation labs are that perfect example of hands-on experiential learning where you're not just reading it from a textbook, but you're doing it. And that's what adaptive learning is about as well. Simulation does not trickle down to other types of learning. Organizations tend to create the check-the-box, meet-the-requirement training. So stop and think about, how does this check-the-box training impact our healthcare system? How does this impact our employees, our patients, and their families? We don't often make that connection back to the impact. And that connection back to impact is extremely important. And the best way to do this is think about an incident that happened at your organization. Just something simple. We were presenting to an organization and we were talking about these types of situations and we were linking it back to adaptive learning. And I asked them to tell me about a recent incident and they all just kind of stared at me. And I said, nothing serious, just something that happened. And their VP of learning said, well, a few days ago, one of our hospitals called me and their housekeeping staff member had taken a vacuum cleaner into the MRI room. And luckily, no one was hurt when that vacuum cleaner was attracted to the magnet. But transformative or adaptive learning will help organizations make that connection between learning and impact. So I challenge you to think about your own healthcare system and take a look at this particular chart. Where does your organization fall? Are you more transactional or are you more transformative? And perhaps you're currently using a mixture of both. So what does it really mean to move to transformative learning? One of the biggest values from transactional to transformational learning is providing multiple ways to consume the same information. Everybody learns differently, and transformational learning provides a better experience and helps improve learner retention. Another value is outcome. The improved outcome is a result of the learner's individual characteristics, their retained knowledge base, through highlighting their strengths and identifying areas and opportunities for improvement. In the past, an educator had to correct a test, identify where the students needed support. It takes an incredible amount of time, and then the educator has multiple students to follow up with. An upfront assessment adjusts to the learner's pace, so no learner is left behind. If a learner does have difficulty kind of as they're going through the learning path, the system will adjust and their training will adjust. So how is all of that possible? How does the system do that? There's algorithms in the background that are analyzing all the data. And while the learner is taking the education, it's actually changing. And it can adjust to the individual's needs and to their abilities. The adaptive learning process provides learners content and prompts of intervention, all based on their answers. The content is filtered down to areas they need improvement on. This relates back to the MRI incident I mentioned earlier. We discussed the training the organization provided. The team told me the training on the MRIs was included in their onboarding and ongoing training programs. So what if you could have asked that employee questions first, then provided training based on their answers? What if the employee wasn't really paying attention because the information was on slide 18 of 25 in the third course he had taken that day? What if he knew the information on HIPAA and he understood hand washing? What if he could have skipped the first two presentations? The knowledge deficiency would have been identified up front, and the training centered around and tailored to his knowledge and his individual needs. The incident might have been avoidable. This training approach can reduce the time that it takes for a learner to complete the training, getting them back to doing their job faster and efficiently. And last, the value of transformative or adaptive learning considers each person as an individual, their strengths making them feel more valued. So the learner feels like they're really in the right place because the organization is giving the individual credit for their knowledge, and we are letting them know the organization values you, we value your time, and we value the knowledge that you have.
So here we have a slide. We're going to talk about the various areas of adaptive learning. The process of adaptive learning is using analytics to measure an individual learner's understanding, their strengths, and their opportunities so that the education is tailored for them. Through analytics, a learner receives a personal learning path which ensures they become proficient in areas they were struggling with. By providing individual learning paths, an organization becomes more efficient in their training. Efficiency comes when learners are given training based on their individual level of knowledge. If you provide training based on the individual's knowledge, their engagement goes up. They tend to pay closer attention. It becomes less about next, next, next. The training becomes a personal experience. Think about this. If you take a training course with 85 PowerPoint slides, you become complacent. You say things like, I know this. I saw this last year. Why do I have to do this again? However, if I answer questions and do not pass a section of the training, and I am only presented the training I didn't understand, my thought process is going to change. I'm going to be thinking, wow, I needed this training. Ooh, I didn't realize I didn't understand this. Yikes, I better read through this. We can't stress enough the message the learners receive is that we value you, we value your knowledge, and we value your time. And lastly, it circles back to what was mentioned earlier. Healthcare needs to be more agile. It needs to be able to adapt and to have real-time revisions. In 1 year, everything changed. Organizations faced new challenges hourly. Standards changed. Policies had to be adapted. Think of all the ways your organization had to become agile. Stop and reflect for a minute on everything your organization has been through in the last 15 months. All the ways your organization, the employees, and you pivoted. Learn from that. Apply that to other areas like learning and development. If someone says, that's the way it's always been, you now have proof it doesn't need to stay that way. Talk about pivoting learning and development and all the ways it can make your organization and your learners better. I know it's lots to think about, and there's lots that goes into this, but let's talk about how to adopt transformative adaptive learning and the way to cut unnecessary costs and reduce training time.
Let's talk about the William Bridges theory. The William Bridges theory is called the marathon effect, and it's used often in change and transformation in an organization. Think about a large-scale change that your organization has made. Often your executive team or the project leads, they're well into the change. They understand the change. They've been talking about the change. So with the marathon, they're on mile 22, whereas your frontline staff is at the starting line. They don't know about the change. They've never heard about it. This is the marathon effect. Everyone is in a different place. So how does the marathon effect apply to learning and development and transformational learning? One thing to think about is the experience level of your nurses. Remember my friend Mary. She's been with the same organization for 20 plus years. She's on mile 20. She has real life experience and multiple trainings. Sometimes the same training year after year. Then you bring on a new clinician, Ted. Ted's been a nurse for 1 year and has been with your organization for 6 months. He's just starting his career in his new job with your organization. You need to consider everybody's learning path along this marathon. If you're aware of where everyone is along the path and where they're going to find the most value in training, you can provide them a unique training experience. A VP of Quality and Compliance I used to work with, she would say, take the mail to the right address. She was all about training the right people with the right education at the right time. Think about that with your learning and your learning initiatives. I remember once a nursing supervisor came in. We had an incident with one of our nurses, and the supervisor wanted the whole organization trained. She wanted an initiative around this for the nursing staff. When our VP of Quality Compliance stopped and she asked one question, when was the last time this happened? And the nursing supervisor thought about it for a few minutes and she said, I think it was about 4 years ago. And the VP nodded and she said, it seems like this is an isolated incident, so let's just talk with the nurse. If our VP of Quality and Compliance had taken that one-size-fits-all approach and not stopped to ask questions, we could have pushed training out to 450 plus nurses based on an isolated incident. So think about that. Think about your personal experiences with learning. How many times has your organization pushed out training to everyone and you think, wow, someone must have really done something wrong, and now I have to sit through this hour-long presentation? Or how many times has someone stopped you in the hall and said, hey, how come we all got this course assigned to us? What happened that we have to do this? And then it becomes part of your annual training program somehow. And now it's 5 years down the road, and someone asks in a meeting, why are we providing this training? Everybody kind of looks around and nobody's really sure, and somebody may have remembered and said, well, I think there was an incident, but I don't remember the details. Organizations are cutting costs. Training costs are part of your labor expense, and sometimes it's difficult to put a number on training costs. Learning analytics will help your organization pinpoint where your cost of training is high and where the bulk of your training is. And then you need to break it down into bite-sized training plans. Ask questions like, do we offer the staff an opportunity to test out a training, and why or why not? Do we ever pause to provide an assessment to help us understand our staff learning needs? Why are we offering these trainings, and who says we have to? When you start asking why, prepare yourself for pushback. And my best advice when someone says, it's mandatory, we have to, your response in a very nice way is, I'm sure you're right, but I'd really like you to show me the law or statute or accrediting body rule that applies to this training. And the other problem is laws and statutes are often left up to interpretation. So you need to ask your legal team or someone with authority to interpret that at your organization. And if you take one of your trainings and offer a pre-assessment or a survey where an employee can test out, or they can tailor that training to where their gaps are, you may improve your outcomes and cut your costs at the same time. So let's say a learner saves 15 minutes. If they pass the pre-assessment, it doesn't sound like a whole lot. However, when you save 15 minutes on one course, all of that starts to add up. So let's look at that across an entire healthcare system. I assigned fire safety to 150 learners. And we'll say half of them, 750, test out. And they don't have to take that 20-minute course. I would say it took them 5 minutes to take the pre-assessment. So 750 people just saved 15 minutes. And let's say the average salary across all those 750 people was $15 an hour, which is $3.75 per 15 minutes. And you can see right there, you've just saved about $2,800. And that cost savings grows across multiple courses over years. It will continue to grow. And I like to look at it as cost avoidance versus cost of savings. Retention and engagement are big considerations in healthcare. We all have turnover costs. In some cases, those costs are avoidable. High turnover affects clinical quality and continuity of care. Transformational learner keeps employees engaged. It shows that you value their level of experience and their time. And the bottom line it comes down to is look at your learning and development to figure out where you can make your biggest impacts and provide the biggest value for your employees and most importantly for your patients.
So there's lots of time that can be saved in learning and development, especially when we've been repeating training for the last 5 or 10 years. You know, reflecting back on Reagan's story at the beginning about her friends that are nurses, those stories resonated with me as we talk about this transformative or adaptive learning. They each had their own concerns. By and large, their concerns were being taken out of their element and being put into another element in a health system to meet the needs of the COVID cases. In that time, we could provide all sorts of training and education to get them ready to cross-train in another area. In most cases, organizations took the one-size-fits-all approach. Imagine if you could have provided them exactly what they needed based on their level of knowledge and level of education. That is transformative learning. This is the time to make the change in your organization. One thing COVID has taught us is how to adapt quickly and how to be nimble with the resiliency around quick change. If you had that immediate learning right at their fingertips, think about how that would have helped ease some of those concerns that they had about moving into a new area. In summary, if I put this into simplistic terms, I like to keep things simple when I can. Transactional learning is something that is given to you. Transformative or adaptive learning is something you seek out on your own. That's probably the easiest way to differentiate between the two of them. I've included HealthStream's vision statement here because it's always important to connect everything we do back to you. This is a good reminder that we are out there to improve the quality of healthcare by developing the people, that would be you, who end up delivering that care. One of the things we are working on here at HealthStream is incorporating transformational or adaptive learning across many aspects of healthcare's learning and development. Right now, HealthStream is incorporating adaptive learning into our compliance products, our learning analytics, our resuscitation product, and then if any of you are familiar with or have used Jane, that is our nurse advisor product, which completely works off a competency-based assessment that once completed It then delivers the information that the nurse needs based upon where that nurse is at in their learning by using an artificial intelligence approach. So these are a few areas that we're focusing our attention on for development of adaptive learning. Well, our hope is that you found the information informative, and again, to get you thinking about how you can move from transactional to transformative or adaptive learning within your own organization. So at the end of the day, value your employees' experience and value their time. Reagan and I want to thank you for everything that each and every one of you are doing every day to support healthcare. We truly appreciate you. Now I'll turn the webinar back over to the moderator for some Q&A.
Thank you so much, Debbie and Reagan, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We'll try to get through as many as we can here. The first question I'll open up is the attendee asks, where do you see learning and development going in the next 2 years?
So advances in technology are continuing, and it seems that we've spent the better part of the last 2 decades focusing technology and healthcare industry on EMRs, surgical methods, disease detection, et cetera. And all of that is extremely important. And for me, it's all about putting technology into perspective. So it was about a year ago, I was talking to my grandmother. She's 99 years old. And when she was 10 in 1931, her brother had his tonsils removed on her kitchen table. And that totally freaked me out. It was beyond anything that I could even fathom happening. And I got to thinking about technology and medicine in my lifetime. And my dad, in 1991, he had a heart attack. He had 2 stents put in, and he was in the hospital for about 10 days, and I think he was off of work for 8 weeks. And then this last year, my brother had the same experience. He had 2 stents put in. He was in the hospital for 2 nights, and he went back to work the next week. So we have to stop and think about how far we've come in that relatively short period of time. And so I really think in the next 2 years, we're going to shift technology and data towards learning and development in our healthcare facilities. So data is going to play this huge role because we're collecting so much of it. We're collecting it on outcomes and through our EMRs and our patient surveys. And so I really think in the next 2 to 5 years, we're going to see data become that central driving force to redefine learning and development. And COVID has taught us that agility is imperative. And through emerging technologies like virtual reality and augmented reality, artificial intelligence, we're going to empower our employees to make those mistakes in safe environments so that we can challenge their assumptions and grow their knowledge and grow our learning and development experiences.
Thank you so much. And this next question, again, gets to some of the transformation that's happened during the pandemic, right? So the attendee asks, how have you seen organizations adapting from in-person training to e-learning?
Well, COVID forced many organizations to give up their in-person training sessions. And I really don't see organizations bringing back in-person trainings that aren't necessary. In speaking with several hospitals that I work with, many are not bringing the ancillary staff back into the buildings full time. And one organization I spoke with even closed all their satellite business offices, and they have no plans for the ancillary staff to return to an office building or even to the hospital unless it's necessary. So organizations are holding some virtual meetings, some virtual trainings. They're doing it lunch and learns, and they're moving the content to e-learning. But it's been a mixture of reviewing their content to see what they already have created, or what has come as part of maybe some libraries that they've purchased to replace that live content. Some cases, organizations did a quick upload of a PDF. They created a test to go with it until they have time to really go in and revisit their trainings. For the most part, those with an LMS, it was a relatively quick transition. But now that things seem to be settling down in many areas, I would think it would be a good time to reevaluate and review to really see the trainings that are being offered and to identify ways to improve the content, the delivery, and then the expected outcomes that you would like to see.
Excellent. Thank you for addressing that one. The next question I'll put out there is, the attendee asks, what process do you recommend in developing personalized pathways based on years of experience?
So many companies out there, like HealthStream or other learning companies, are offering content that's fully developed and ready for use. If your organization is going to self-develop it, it is time-consuming and it is expensive, but that easiest place to start is with your annual mandatory education. It's mandatory. Everybody in your organization has to do it, and it's this huge time commitment. And in general, it's extremely boring. I have never had an employee come up to me and say, yay, it's time for annual education. So when you're thinking about OSHA and HIPAA and fire safety and so many more, we started all of our training in October. I usually spent most of December reminding and begging employees to get it done. So just think about that. If your employees could breeze right through it, start with those pre-assessments in small bites. If I answer these 3 questions correctly, I can skip this entire section of the course, or I can move to the next one. And so you have to think about your audiences too. And that might mean creating just a few more options. For example, right now, if you do clinical and non-clinical, that means that your nursing assistants and your nurses are basically taking the same education. So is that really an appropriate use of their time? But on the other hand, you don't want to break it down too far because then you have way too much to get into. So consider all of your audiences and the best ways to group them together. That's pretty vital. And then think about like licensed clinical groups that include your RNs, your ARNPs, your physician's assistants, and then think about that other patient-facing group that's maybe your social workers and your nursing assistants and some chaplains. They may have similar content. For example, licensed clinicians would have pain management with pain scales and how to discuss pain with your patients, whereas your patient-facing group might have nonverbal signs of pain management and when to talk to your doctor or nurse because you think the patient might be in pain. And with that pre-assessment, your experienced staff, they can look through it and test out of those sections that they understand, that they don't need more training on, but it'll help remediate them where they do need it. So it's just a delicate balance of moving slowly with your annual training as a beginning.
Thank you so much. I think this next question serves as sort of a great follow-up, really thinking about your audience and their perspective. So the question is, what is your experience in helping organizations make annual mandatory training more engaging?
So in talking with learners, again, the biggest complaint I hear is, why do I need to know this? It's kind of like when your teenager comes home from school and complains about algebra, and they're saying, why do I need this? I have a computer that can do it for me. So you want to review the content in your courses to determine what is fluff, what is really not necessary, and what do employees really need to know to do their job. For example, do I really need to know a Hungarian doctor who, working at Vienna General Hospital in the 1840s, is known as the father of hand hygiene? Probably not to do my job. I do need to know how to wash my hands and when to use soap versus hand sanitizer, and maybe adding a quick sentence or 2 on why that's important. You would be surprised at the number of educators who think the history is important. I know some think that if you don't know the history, you're doomed to repeat it. But in this case, I think a sentence or 2 about why it's important to prevent the spread of disease is sufficient. Instead of the 10 slides that we had on how they came to discover that newborn death rate was directly linked to doctors performing autopsies, and then they would go into the delivery room and not wash their hands before they delivered a baby. So we want to stop to think about this. If I was new to the healthcare profession, what is vital for me to know before I begin interacting with patients and their families? Not the history, really. Not really the federal agencies that requires the red sharp boxes, not how the x-ray machine was invented. Really what I need to know is when and how to wash my hands. I need to know how and where to dispose of needles and what to do if I get stuck. I need to know where to stand if an x-ray is taking place. As hard as it is, the courses aren't college papers that require 9 pages, single spaces, 2,500 words. Really, I think short, precise information is what's going to win.
Absolutely. It's really a pragmatic approach to learning. Appreciate you tackling those, and we'll right into the next question here. which is how do you begin to initiate organizational change on learning strategies when faced with resistance?
Okay, so I actually think this is probably one of the biggest hurdles that we face. You probably are going to need to start with your leadership to get buy-in there. Through the review of the education you are providing, start small and present your findings and recommendations to your leadership. Focus on streamlining your approach and where you expect to see a cost savings. Ask the leadership to identify someone in the organization who wants change, but also has the authority to make the decision when maybe there's a disagreement on the direction to take. That's always helpful. Once you get leadership on board, then you're going to want to turn to your subject matter experts, or they're sometimes referred to as your SMEs. There's many factors that contribute to resistance with the SME. Maybe it's fear, lack of understanding. Maybe they'll feel like they're no longer needed or relevant. They might have insecurities. But I found that when you talk with some organizations, regarding change, their favorite line was, well, we passed Joint Commission, so let's not rock the boat. But to me, again, that's going back to that same old, well, that's the way it's always been done. So no organization, whether it's Joint Commission, DMV, CMS, CDC, they never intended to squash progress in learning and development. It just sort of happened and was born from fear. So we want to remove that fear. Talk to the accrediting bodies, review your policies, talk with other people in the industry, and arm yourself with the details in the conversations. We really want to remove the fear. The subject matter experts are sometimes, they can be territorial. Their content is vitally important to how the organization operates, and they feel if I'm not needed to provide my expertise, they might not need me anymore. Or if we get cited, it's going to be my fault. So we really want to review the state and federal statutes on topic. We want to listen and learn from them and then work with them to move forward. We want to do things like updating the policies to reflect new training methods. I say be kind, be patient, be persistent, and really value the knowledge of your peers, but challenge them to be better and figure out how we can do better for the organization in the learning and development.
Thank you. And the next question we'll grab here is on the long side, but I think it's a really great one. So the attendee asks, have you heard the saying that nurses eat their young? I was introduced to the concept at a health system where the seasoned nurses were very hard on new nurses, resulting in an unhealthy environment for nurses and patient safety. What, in your view, are best training approaches and methods to improve collaboration among nurses of all ages and years of experience?
So I think one of the best kind of approaches that I can think for this, and I think this answers another question that was asked as well, is you want those nurses who have the experience to collaborate with those younger nurses of all ages and all experiences. And we had nursing boot camp when I worked at my organization for all of the new nurses that were coming in to the organization. And we kind of weeded them out, so to speak, or based on their experience. And so we would give them a pre-assessment, we would have them do a couple of different skills, and that kind of let us put them in groups. And then we could have those people that had the experience work with the nurses that didn't. And so it created that collaboration and that learning experience. And we also had a lot of preceptor programs, and we made sure that those preceptors came to training and that they understood what it was to be a preceptor and how they could collaborate with the nurses and the younger nurses so that you didn't have that unhealthy relationship and that unhealthy environment. And it's a difficult balance because you don't want to pit them against each other. You want the nurses to know that you're coming to them because you value their experience and you value the knowledge that they have, and you want them to pass this on to the younger generation. And it doesn't necessarily mean that you're trying to push them out, but you also have to have that, that succession planning going on as well. And they have that knowledge and they have that experience. And so any ways that you can show how much the organization values that by not making them go through all of these unnecessary trainings that they've been doing, but allowing them to teach those trainings and to show their value through those experiences that they've had.
Thank you so much. And I think this next question might be the one you were pointing to that you sort of also addressed. You gave someone an answer to this as well, but I'm going to ask it again just in case you have more to add. So the attendee asked, I love these concepts, but does it assume individualized training? Is there a way to be adaptive in group learning settings?
Yeah, that's the one I was referring to. Thank you. But yeah, so that's it. You have that. You want those experienced nurses to be at the front and center. And you want to show them the value that you see in their knowledge. We actually, in our organization, if they agreed to be a preceptor, we gave them a little bonus every time that they did it, and that encouraged them to share their knowledge with newer nurses. It wasn't much, but it was something to encourage them to do that. And then I think, if you're in group settings, there's always people in the room that you can turn to. And a lot of times if they're new, again, you have that initial maybe test or pre-assessment that you give before they come into the group setting so that you kind of know where your learners are and who you can count on to help you and who you can turn to and say, tell us your experience. We know you've been in healthcare for 5 years now. And what was your biggest struggle as you came on, or your biggest struggle as you were talking about this topic? So I think that's a way to include, if you kind of know where they are before they come into the group setting, it'll help you encourage them to share their experiences and their knowledge.
Thank you for that further clarity on that question there. And I think this question is sort of in the same vein, but brings in the regulatory piece of it. So the attendee asked, much of the training in healthcare is driven by regulatory requirements, which are highly detailed. How can we individualize training when regulations determine the content of annual training?
So this is where you get into what we were talking about earlier versus what is in the regulation versus what your subject matter expert is telling you is in the regulation. And so one of the things that we always struggled with at our organization with that regulatory training was they need the history. Well, they don't need the history. They need to know how to do their job based on what the regulation says. And so it's a lot of weeding that down and finding out what is truly important in that regulation, what is that regulation truly telling you that they have to know to do their job. Like I said, they can be vague, so you need to look at your organization's policies as well. What is our policy on hand washing? Because the government or the state tells me I have to train on it every year, but it doesn't necessarily tell me what needs to be in that training. And so that's where you need to determine what do they need to know to do their job versus what is too much information that the regulation isn't really talking about. And that's where you can get down to that individualized training too, because you're asking them those pre-assessment questions first to understand their knowledge, and then they're getting the training based on how they answered or responded to those questions. So you may have this course built out, and if they answer these two questions correctly, then they skip 5 minutes of that presentation, or they skip these 2 slides and they go to the next one, and then they take the question. And again, if they miss the question or the 2 questions, then they go through that training. And so it really helps you understand what they understand, and as they're moving through that regulatory training, they're getting the information that they need to do their jobs.
Thank you so much. Some really helpful information there. And as we're approaching the end of our time together, this will likely be the last question. So what do you think of the gamification of training, a fad or the future?
So from our experience with HealthStream, it's a fad. So we did develop several of our regulatory library courses into games. And I'm guessing here, so don't hold me to this, but I think we had about 5 million course completions in our regulatory library last year, and only 25,000 of those came from our games that we created. So I think that while everybody thought it was this great idea, I think it was very hard for organizations to make that transition. I think you're more likely to make the transition to being able to test out of content while you're making your content more engaging rather than gamification of the training. That's kind of what the trend that we were seeing. We just didn't get a lot of buy-in and a lot of utilization of our games from our customers.
And I was just going to add to that, Reagan, you know, in my previous organization, I too had seen that as well. There were gamification, and it really was not overwhelmingly used. It was a very, very small percentage of folks that would use that type of training.
I appreciate you both weighing in there. And, you know, Reagan, Debbie, thank you so much for a great presentation and for tackling those questions. I also want to thank HealthStream for sponsoring today's webinar. Everyone enjoy the rest of your day, and we look forward to having you join us for future webinars.